Hello, Nursing 120 class. These next two series of lectures are going to be on nutrition. I've broken them up to start talking about what the components of nutrition are, the body's metabolism, how we use food, what different minerals and vitamins are, how we categorize those. Then the second part will be looking at your nutritional assessment that you perform as nurses on your patients and see the different impacts that nutrition can have on disease processes and overall health. So let's get started. There's lots to nutrition, different food groups, and people's understanding and perceptions of nutrition can vary greatly. This is just a little joke. You know, people are always talking about the foods that are good for them versus the foods that are bad for them, and each person's perception of this can be a little bit different. So digestion. Digestion occurs in the GI tract. Each part has a function. It is the mechanical process of breaking down food. It starts with the mastication or chewing and the swallowing. And the peristalsis moves the food down into the stomach. There's also the chemical process, where enzymes, which are protein-like substances, and secretions found in your saliva break apart food. This takes us down to the end products of food: carbohydrates and monosaccharides, fat, fatty acids, glycerol, and proteins are amino acids. And then absorption is the movement of the end products of digestion into the circulatory and lymphatic systems. And our small intestine, or the ileum, is the primary absorption site. Small finger-like projections on the wall of the intestine, called villi, and then even smaller ones, microvilli, help move the food along in its components and help absorb. 85 to 90% of water is absorbed into the small intestine. Some minerals, electrolytes, and water are absorbed in the large intestine. Now the body has to use the nutrients, and this process is metabolism. It's regulated by hormones in your thyroid. Biochemical reactions within the cells. There's two types: anabolic, which is building. It uses the energy to build protein, triglycerides, and glucose. And catabolic, which is the breaking down of larger molecules in order to release energy. When thinking about nutrition, there's an energy balance that needs to be maintained. In order to have a stable body weight, you have to have an equal energy balance. The energy content in food is measured by kilocalories. We have our resting energy expenditure, or our REE. These are the kilocalories that are needed to maintain all of body's normal functions just at rest, also called the basal metabolic rate, or BMR. BMR and REE are affected by age, gender, growth, body size composition, one's genetics, the climate, and thermic effect. Energy allowances, that's how much extra energy you need, are affected by physical activity. For example, athletes need more energy, children going through growth spurts, a female in pregnancy, and certain illnesses. Life-sustaining functions for your BMR are things like breathing, circulation, heart rate, and temperature. To put it into another equation, your total energy expenditure is equal to the resting energy expenditure, the REE, plus the amount of physical activity that a person does. So how many calories are needed? Well, this varies upon life stage. Newborns need 100 to 120 kilocalories per kilogram a day. As they grow into infants, this is 90 to 110 kilocalories per kilogram of body weight. Children are rapidly growing. In preschool, they need about 1,300 to 1,500 kilocalories a day. 6 to 8-year-olds, between 1,800 kilocalories a day. In adolescence, we start to adjust between female and male by the age of 9 years old. Females need roughly 2,000 kilocalories a day, whereas males need anywhere between 3,000 to 4,000 kilocalories a day. As humans reach adulthood, there's different age ranges and also divided between male and female for the average calories that are needed daily. As you can see in the chart, males typically require more calories than females, just based on size and metabolism. However, all of this is relative. If it's a female athlete or someone that's very active, they will require more calories regardless whether they're female or male. As we age, metabolism tends to slow down, so 51 years and older require less calories they did in their youth, teenage years, and middle age. So what are the essential nutrients that we need in order to sustain life? The nutrients that are not produced by the body and needed for life function are carbohydrates, proteins, fats, minerals, and vitamins. So what are their functions, and what are the photochemicals that make them up? Carbohydrates are our major source of energy. They should represent 45 to 65% of total daily intake. 1 gram of carbohydrates equals 4 kilocalories. Glucose, or sugar, is the end product of carbohydrate metabolism. There are different types of carbohydrates. There are simple ones that are mono and disaccharides, and there are complex, which have polysaccharides, starch, fiber, and glycogen. You want to eat carbohydrates in their most natural form, thinking of whole grains that are less processed and not stripped of nutrients, and they also have more fiber. Proteins are necessary for growth. They build muscle and repair damaged muscle tissue. 1 gram of protein is equal to 4 kilocalories of energy as well. And our RDA, our recommended daily allowance, varies 10 to 35%. There's a variance here between the requirements for women and men. Women require about 46 grams a day, whereas men require 56 grams a day. For healthy adults, 0.8 kilograms of ideal body weight is the recommended amount of protein that you need. There are 9 essential amino acids that need to be consumed. Incomplete proteins lack 1 or more essential amino acid, whereas complete proteins contain all 9 amino acids. You need good protein intake for wound healing. Think of surgical sites, skin breakdown, or traumatic wounds. Maintaining nitrogen balance is an important role of proteins. You can go into a negative balance if burns, fever, starvation, a head injury, and trauma, which puts you into anabolic metabolism. A positive nitrogen balance is demonstrated by a need for protein growth, for example, in a growth spurt. Lipids are the most calorie-dense element. 1 gram of lipid equals 9 kilocalories. But lipids are necessary for energy, transport of fat-soluble vitamins. They promote absorption of nutrients. The RDA is 20 to 30% of your total intake, and only 10% should be saturated fats. There are different types of lipids. It's important to understand the differences between them. There's unsaturated, mono, which are 1 carbon to 1 carbon double bonds, and then poly, which are multiple carbon to carbon double bonds. These contain your omega-3, omega-6 fatty acids. Saturated fats are solid at room temperature. There is no carbon to carbon double bond. Hydrogenated fat and trans fatty acids. Cholesterol is a component of lipids, and there are 2 types. Your LDLs, or your low density, and HDLs, high density, which can be considered good cholesterol. Here's the diagram that shows the different carbon and carbon bonds of a saturated fatty acid, monosaturated fatty acid, polyunsaturated, and then an A-frame polyunsaturated fatty acid. Just a little joke here with these avocados. There really is good fat. Our body needs it. And the best forms of fat are usually found in polysaturated fat, and such as in your avocados, your omega-3 fatty acid fish like salmon and mackerel, and your olive oils. As we continue to discuss the essential nutrients, let's talk about vitamins and minerals. Vitamins are organic substances found in small amounts in food that are essential to normal metabolism. There's fat-soluble that are stored in fatty areas of the body, and you have to be careful because these can build up and form megadoses, or hypervitaminosis, more than the body needs. These vitamins are A, D, E, and K. Next are water-soluble. The body does not store these, and they are needed daily. C and B complex, B complex is made up of 8 vitamins, are water-soluble. Then there are minerals. Minerals are inorganic elements that act as catalysts in biochemical reactions. Microminerals, we need more than 100 milligrams a day, and microminerals, less than 100 milligrams a day. Let's look at the different sources of vitamins. So vitamin B sources, they support the body's metabolism and help produce energy. There are 8 well-known B vitamins. B6 helps produce insulin, fight infection, and creates non-essential amino acids. Folate, which is also called folic acid, reduces the risk for spine and brain deformities, such as spina bifida. It's important before and during pregnancy. Prenatal vitamins offer extra folate to help prevent neural tube defects that lead to spina bifida. This is not as much a problem in developed countries anymore, but it's still important for women to take those prenatal vitamins. B12 helps create RBCs, red blood cells. A deficiency can cause anemia. Then there's thiamine, niacin, riboflavin, pantholinic acid, and biotin. Vitamin B supplements are often given to alcoholics. It's called an oral rally pack. It's also thought to improve cognition and can be used in dementia patients. These vitamins are water soluble, and many foods are fortified with B vitamins, such as cereals, breads, yogurts, milk, and cheeses. Other sources are lean meats, eggs, almonds, and peanut butter. Vegetarians and vegans may have to take additional supplements, particularly B12. Vitamin C is also known as absorbic acid. Its biosynthesis of collagen, protein metabolism, wound healing, epinorephrines, and steroid hormones. It's an antioxidant, which means it builds up the immune system to fight infection and disease. A deficiency of vitamin C can lead to bruising, petechiae, bleeding gums, and scurvy. And at risk are smokers, poor fruit and vegetable intake, alcoholics, stress, illness, and oral contraceptives. Vitamin C is also water soluble and can reduce the risk of oxidative stress from certain diseases, such as cancers and cardiovascular disease. Scurvy, which is one of the deficiencies or one of the problems, is fatigue, poor wound healing, widespread connective tissue weakness. It's not as seen much anymore. It used to be found in sailors that were at sea for long periods of time and weren't getting adequate citrus fruits and vitamin C. It's still seen today in underdeveloped countries that have a scarcity of fresh fruits and vegetables. Now let's talk about the fat-soluble vitamins. This is a little acronym that can help you remember them. All dogs eat kittens. So vitamin A, D, E, and K are fat-soluble vitamins, and they require the presence of fats to be absorbed, and they are stored in fat. So excess of these vitamins can lead to toxicity or hypervitaminosis. The fat-soluble vitamin sources. Vitamin A can be found in liver and deep yellow and green leafy vegetables and fruits. Vitamin D can be obtained through sun exposure, milk, fatty fish, and cereal. Vitamin E is found in plant oils, whole grain breads, wheat germ, and sweet potatoes. And vitamin K can be found in egg yolks, liver, and green leafy vegetables. The head of integrative medicine for Novant, a former Atrium doctor, advises that vitamin D supplements is one of the best supplements to take related to our indoor lifestyles, and as well as the use of sunscreen. It can help with calcium absorption and heart function. Minerals are catalysts to initiate biochemical reactions in the body. They are present in a variety of foods, and often foods are fortified with extra minerals. But be careful because too much can lead to toxicity. A deficiency in minerals can result in health issues such as an enlarged thyroid that creates a goiter, osteoporosis, and muscle weakness. Minerals can interact, and excess of one can cause deficiency in another. This is a helpful chart with all the list of minerals and their sources that are available. Potassium is also found in bananas, and lots of juices are now fortified with extra potassium. Fluoride, we need to take note and ask your patient if they have well water. Someone that has well water, it's not treated with fluoride like city water. Back even when I was in elementary school in the 90s, they made us do swish, where we would rinse out our mouth with a fluoride rinse. This was to help cover any possible children that did not have fluoride in their water. Although all of us lived in the city of Charlotte, so I'm pretty sure most of us did have fluoride. Fortunately, I don't think they make children do that anymore. The last category of essential nutrients are plant stanols and sterols, also known as phytosterols. These are cholesterol-like compounds derived from plant-based foods. They can include things like vegetable oils, vegetable oil-based spreads like Benecol and Smart Balance. Some orange juices even fortify with plant sterols now, and there are also many foods enriched with PSS. Research-based studies have shown that these can help lower LDL or bad cholesterol levels. Now that we've talked about all of the essential nutrients, we have to consider the factors that affect nutritional absorption. There are many, such as alcohol consumption, a person's liver and renal function. Decreased GI peristalsis can have a big impact on absorption. Decreased in digestion enzymes and ALC or hydrochloric acid. Certain GI disorders. Polypharmacy or a cocktail of different prescribed medications and chronic medication use. Diseases and pathological processes. Continuing on with factors affecting nutrition, across the lifespan we require fewer calories as we age. There's also a decrease in sense of taste. I remember that my grandmother used to salt her cantaloupe. This was a big surprise when you took a bite into it thinking it was going to be sweet. Culture, food is an important part of celebrations and social interactions. It could appear rude if you refuse to eat certain things when attending a cultural event. Economics, eating healthy is costly. Within our community of Mecklenburg County and throughout the world, there are food deserts that lack fresh food, grocery stores, and farmers markets. They have limited options such as fast food and food from convenience stores. There are picky eaters, whether they're children or adults, where the variety of food is not great. And also thinking about food prep time. it takes time. So our fast-paced Western lifestyles, we're oftentimes grabbing things that might not be the healthiest choices. When thinking about medications, they can alter the taste or cause GI upset, and sometimes you cannot eat certain things, such as no grapefruit with statin drugs. After you finish listening to this lecture, I placed on the Moodle page information, a link, what Atrium and Novant Health are doing with a local food pantry. They created a mobile food pantry to go out into the community and alleviate some of the food deserts so that healthy foods are available to everyone in the community. Continuing with nutrition across the lifespan, infants through school-age children are rapidly growing. They have high protein, vitamin, mineral, and energy requirements. Start introducing solid foods to babies when they're 4 to 6 months old. Usually this is like a rice cereal or those little fruit squeezers. Toddlers should drink whole milk until the age of 2. Once children are school age, monitoring food intake at school can be challenging. This is why it's important to have a good, healthy breakfast. Throughout the U.S., schools offer free breakfast and reduced lunches to help children maintain their nutrition while they're at school if they don't have good food sources at their home environment. Adolescents' needs depend on their age, growth spurts, and the physical activity. Adolescent athletes will require more calories versus someone who's not as active. In this time of social pressures, eating disorders tend to develop, such as anorexia and bulimia. So it's important for family and friends of adolescents to take interest in their, in their children's lives and take note if they see any signs of abnormal eating patterns. Adults need nutrition for energy, maintenance, and repair. A lack of physical activity, such as now having desk jobs and not being as active, along with a decrease in metabolism, can lead to obesity. And nutrition, both preconception and during pregnancy, is important. It's healthy for mom and the baby. During lactation, women need 500 kilocalories a day more than they would regularly. And adults greater than 65 have a decreased metabolic rate. They need less calories. However, their vitamin and mineral requirements stay the same. As previously mentioned, culture is a big important component of nutrition. And a lot has to do with ethnicity. Culturally competent care is understanding your patient's preferences. African Americans, Mexican American, Asian American, European, Middle Eastern, Indian, even Southern, we all have our own cultural food preferences. So food is an important part of cultural celebrations and being social. It's involved in many houses of worship. So we need to kind of educate patients, if they're having lots of fried food, carbohydrates with beans and rice and fats and limited fruits and vegetables. We kind of need to help do some education on not eliminating these foods, but ways to balance it out with some other healthier options. Understand that patients may prefer to bring their own food to the hospital. Teach patients about the Mediterranean diet that's with fresh vegetables, fish, fruit, and healthy fat. And then start to understand some of the religious practices of your patient. They may fast for periods of time. They may be a strict vegetarian or have halal practices, which is the way that the meat can be prepared, and they may not consume any alcohol. So keep these considerations in place as you care for your patient, because food is one of the most enjoyable things in life, and so we want to keep that patient's happiness, but help educate them on ways to maintain a healthy diet. Nurses play a big role in nutrition health promotion. We use the evidence of the Food Guide Pyramid. The most recent one is from 2020. The USDA puts out dietary guidelines for Americans about every 5 years. So currently we're on the 8th edition that goes from 2015 to 2020. They're working on another one, which will be out next year, maybe the end of this year. So dietary guidelines for Americans includes weight management, healthy eating patterns, exercise, and helping patients read food labels, understanding where there are hidden sugars, fats, and sodium. A goal of our healthcare in the U.S. is disease prevention and management. And we do this in nutrition by teaching patients and people in the community healthy diets, such as the DASH diet and Mediterranean diet. And we'll talk a little more in detail about what each of these is. The USDA dietary guidelines have 5 main focuses. They want you to follow a healthy eating pattern throughout the lifespan, focus on food variety, nutrient density, and quantity. Really emphasize eating the rainbow. Eat colorful foods. Do not drink your calories, so limit calories from added fats, sugars, and sodium intake. Avoid or limit fast food and overly processed foods. Foods in their most natural state contain the most nutrients and are healthiest. Shift to healthier food and beverage choices, and create and support healthy eating for all. It's important to create an environment in your home and community that supports healthy eating. This includes meal planning and preparation, nutritious snacks, learning healthier ways of making comfort meals and traditional foods, and decrease our portion sizes. Portion sizes have tripled in the United States since the 1950s. So a little more detail about the key recommendations of a healthy eating plan. Eating that variety of fruits and vegetables. Grains should be whole. And when looking at whole grains, the first or second ingredient should state whole grain. Avoid added processed sugars like fructose corn syrup in breads. Fat-free or low-fat dairy, and it can be soy. There's a lot of coconut products and different types of almond milks and things like that available. And when looking at fat-free or low-fat, be careful because they may have added sugar, salt, or artificial flavors, sweeteners for flavor. Try plain yogurt and add fresh fruit with a little honey. Greek yogurts contain more protein. Look for a variety of protein sources, such as seafood, lean meat, poultry, eggs, legumes, nuts, seeds, and soy. Trying to use healthy oils instead of solid fats like butters, lards, and shortening. A healthy eating plan limits saturated fats, trans fats, added sugars, and sodium. So trying to set goals daily. Less than 10% of calories per day from added sugars, less than 10% of calories per day from saturated fat. They have taken away a limit for total fat intake because we know that our bodies do need fat, especially those healthy fats, and the fat-soluble vitamins, we need those for absorption. But being careful with the processed, the hydrogenated, the trans fats. Only 10% of calories per day from those types of saturated fats. Less than 2,300 milligrams of sodium per day. Being careful to look at those packages, especially those condensed soups that contain a lot of added sodium. Then no more than 1 alcoholic drink a day for women and 2 a day for men. A healthy alternative is when baking or sauteing, use healthy oil and non-stick to use less. You can substitute plain applesauce for oil in baking. The website choosemyplate.gov is located on your Moodle page, and this will help you as you study, as you create meal plans for yourself, loved ones, and patients. I would like you to go and explore this. It helps you figure out portion sizes, what are good options, as well as even for patients and ourselves that are on budget restrictions. How can we still get these healthy food choices with limiting budget and not spending as much money? Along with eating well, we need to maintain good physical activity. So the USDA has physical activity recommendations. Americans of all ages should meet physical activity guidelines for Americans. This promotes health and prevents disease. We're looking at a goal for adults to have 2 hours and 30 minutes a week of moderate activity, 1 hour, 15 minutes a week of vigorous activity, something that really gets the heart rate up, gets you breathing heavy. Aerobic activity should be at least 10 minutes of aerobic activity a day. There are additional health benefits by increasing to 5 hours a week of moderate activity, 2 hours and 30 minutes a week of vigorous activity. And also, adults should incorporate muscle strengthening activities, such as weightlifting or resistance training, push-ups using their own body weight, on 2 or more major muscle groups on at least 2 days a week. This really helps with creating bone density, muscle mass, and supporting your overall frame and your health. So this is a little chart. Adults need a mix of physical activities to stay healthy. It shows you examples of moderate, intense aerobic activity, muscle strengthening activity, and whatever it is you like to do, especially right now being inside, bad weather, snow, quarantine restrictions. There are so many services that stream different options you can do inside, whether you want to dance, do an aerobic class, do jumping jacks, do some fun yoga with your children, whatever way you can find. Just important that we need to move. Our bodies were made to move. This ends the first part of our nutrition lecture series. I encourage you to go look at the Moodle page and see some of those videos and resources that are on there. The next nutrition lecture will start to cover how we do our nutritional assessment. So now we just talked about moving. Get up, take a break, get out there and move, and please feel free to reach out with any questions that you may have.